Well, thank you very much for inviting me here to contribute to the conversation. And it's a real pleasure to be with a group who's both embracing the idea that it's not a matter of whether we should share data, but how, and really digging into the problem solving around how we might make this happen, and thinking through the things what is getting in the way of our sharing. If it's such a great idea and there's all these ethical and practical reasons why we must do it, why aren't we doing it? And I think the technical and regulatory issues are certainly significant. And I want to just spend a few minutes talking about the cultural issues, because I think these also warrant some attention. And what's a second pleasure of being with this group is, while I believe I'm the only ethics person on the docket, ethics and culture have been throughout your remarks today. And so I'm just going to amplify much of what is being said on the program. So many people have pointed to this idea that trust is really at the heart of helping to make these data sharing efforts happen. And this is trust across our relationships. So think about this is researchers trusting each other, organizations learning to trust each other who haven't traditionally done so. Essentially participants trusting the researchers and trusting those organizations. So how do we get there? I think traditionally in research relationships, we've relied pretty heavily on contracts to help us manage these trust relationships. So we've generated these crazy consent forms to really outline everything so that we're on the same page with expectations around what participants are getting into with a trial. We have data use agreements and terms of use, other contracts that manage our research relationships. And I think these are certainly necessary. I would say they're necessary but not sufficient when we're thinking about ethical research management. So I really want to put on the table another way of thinking about approaching our research relationships as essentially relational. And almost the contracts come in as a way to punctuate what we've already agreed to and what we're already understanding, rather than the sum total of how we should approach each other. So the ways we've learned from both empirical study and philosophical thinking around when do you trust someone? Think about your own relationships, and when you trust someone, there's a number of different elements that might go into this. Sometimes we trust someone who we haven't even met, but we trust them because we share core values, or we share commitments, and we recognize that we're working towards a common purpose, so we can trust each other even though I don't know you very well. So sometimes on that very common basis, we can find a path towards moving forward. Another way we often trust each other, this is seen in many medical relationships, is I can trust you if I know you have my best interest in mind. So think about how this is true in our research relationships. How is it true that we might have each other's best interest in mind in the way we approach our efforts? Another way to establish trust can be, I don't know you, I'm not sure that your statements of values and mission are that you have enough accountability in them. So I need to look for your rules, those rules of the road that Jennifer referred to. Are they clear and transparent? The way that this system is going to function, can I see it well enough to understand how it might work? And that might be one way we can accomplish trust. And then finally, we have trust by association. So when someone else I trusts you, I can also get in the door. So there's the thing that many people have been referring to. I've been at an academic medical center for 20 years now, and I can say that these are not insignificant. The deep culture of academic medicine that relies on our whole promotion system relies on individual credit for publications and grants awarded. And so this is in deep competition right now with the things that we know make research work faster and better, which is more open sharing. And so the idea that I think the thing that's promising and hopeful here is that there's not just one culture in science. I think that old model in academic medicine is really, it's crumbling at the edges. We can see it. It's not going to last. And so, it is us. So it's up to us to really transform it and change it. And we have lots of successful models around us to help us build into this new space with academic medicine. So whereas competition, it's not taking competition off the table. We can look to open science spaces to see how these are incredibly competitive environments and spaces, but the competition happens in open space. And it's that open space that actually accelerates and fuels the competition. So there are ways, as we've seen in a couple of the examples already today, that we can do rewards, acknowledgement, attribution, and development, accelerate development in an open space. There's no need to hold this so closely to our chest. We have, as I said, in many industries, we're seeing evidence of this change. So in information technology, we've seen this happen within our very recent lifetimes. So we went from kind of an expert-driven model where you had to have whole IT departments and massive server farms to manage your data access and data use. And now we're in this really user-driven, we've democratized data and data access and how people are using it in mobile and cloud source technologies. And we've really, in some really exciting ways, have made this available to everyone rather than the limited expert-driven few. So I think we can this culture shift has happened already in other fields, so let's move it into health research. One thing that can help us do that is staying grounded in our ethics. So these are the old-fashioned research ethics from the Belmont Report and many millennia prior to that. That really helped keep us in medicine and science remember what's important, which was respect, benefit, and justice. And if we think kind of with a new lens on these questions, so what does respect look like in this new open space? What does respect look like? How can we assure that our research processes are accomplishing benefits, and benefits for whom? Who decides what counts as a benefit? And have we created systems that are really equitable and fair? And if we for me, these are truly a touchstone. If we can keep coming back to these ethical foundations as a guide to us as we develop our practices and our processes for moving forward, I think we'll be on the right track. So just as a quick example of what respect looks like, I think how the Belmont Report got operationalized in our research ethics
Welcome to WebEx. Please enter your access code or meeting number followed by the pound sign.
Telling people what we were going to do and asking their permission to do that. I think there's a whole, that's one way we can demonstrate respect. There's a whole host of ways we can
Please enter your attendee ID number followed by the pound sign.
About it, respect has
if you do not know your attendee number, just press pound to continue.
So this is respect.
Welcome to WebEx. You will now be placed into the conference. You are the first attendee to join the conference. Please stand by.
So respect can be reflected through greater acknowledgement, greater expressions of gratitude. I'm taking an informal poll of researchers I work with on how often they just say thank you to the participants that are in their studies, and it's embarrassingly low numbers. So simply saying thank you can go such a long way. Having more exchange or more reciprocity in what is in it for me to enter into this collaboration with you. And some of the discussion we had after the last panel, I think, really pointed to that. Sometimes what might make a difference to someone in that partnership isn't what you think is valuable, but it actually is what's valuable to that person, and that's the thing we have to pay attention to. So amplifying other speakers, communication is just essential here, and really keeping a network going. So one way I've been thinking about this is the relationship between ethics and the law is the regulations really just provide the floor of our behavior. We can't go lower than that. But if we take the airline industry as an example, you know, we want to do more than just what the regulations mandate that we do. Data sharing policies and such will start to provide a scaffolding for us, but it really is up to us as a community to set our standards of excellence and what's important for us. I'd really take a page from advocacy-run research groups in this. They've taught me a lot working with Sharon Terry and Genetic Alliance and PXE as a model of how there were 4 things that came out of some of our work together in building better biobanks that I just wasn't seeing as present in academic medical centers. So what I was seeing as different from an ethical perspective with the advocacy-run banks research practices, success was right at the forefront of what they were trying to accomplish. They never lost sight of why they were trying to approach the research. Why were they trying to get the research done? It was for the health of people, and they worked with the relationships, the networks that they had. They forged new relationships, surprising alliances that they hadn't normally expected. And I think some of the alliances we're seeing in this room are one reflection of just that kind of creativity. I think and a third principle was the idea of flexibility and being nimble. So when barriers did come up and get in the way, they didn't stop the train. They actually just found a way to move the tracks around that barrier and keep going. So it was keeping an eye on success throughout the whole thing. So just in closing, I'm hearing a lot of hope in this room, and that's just so encouraging. When I prepared the slides, I was thinking I might need to help provide hope, and Seamus Haney really does that, which is we've got a lot of history on our side that says don't hope on this side of the grave. But then once in a lifetime, the longed-for tidal wave of justice can rise up, and hope and history rhyme. And I'm hoping what we see here today is a lot of practical examples of how we can accomplish this together. Thank you.